Good morning to everyone. It is certainly a pleasure to see everyone here. Thank you for joining this an incredible conversation that we're going to be having today. I am Stacey Stewart, President and CEO of March of Dimes, and it is Black History Month. In many ways, it's Black History Month every single month because Black history is a part of American history. But this is a month of February where we really recognize the contributions of African Americans, of Black people in this country. And it's also an opportunity, the March of Dimes, to further look at some of the issues around the things that matter most to the mission of March of Dimes around health equity and the issues that we continue to deal with in this country with respect to Black people and other people of color and our access to high quality health and health care and so many other issues that affect that. And for this conversation today, I couldn't think of anyone more appropriate, more engaged in some of these issues, more interesting to our American story and to our African American story in this country than someone who I've known all of my life. A lot of you all know that I'm originally from Atlanta, Georgia, and still have very strong connections and roots and love for Atlanta. And I am so honored that former Ambassador Andrew Young, former Mayor Andrew Young, who for this session, because I've known him for so long, I will be calling Andy. And I know that he's very warmly accepting of people calling him Andy, as a lot of folks do in Atlanta, has joined us today. And it is such an honor to be with him, to listen to him. Every time I listen to him, it is, I just am thrilled and learn so much about the history of this country, what he's experienced in his own life. His life experiences are simply amazing. And I'm so glad that we can have him with us today. Ambassador Young, Andy, thank you for joining and thanks for being with us this morning.
Very good. Glad to see you and glad to have this opportunity to reminisce with you about the good old days in Atlanta.
Absolutely. And even when I look at your background and I see that Young sticker, it reminds me of some of your campaigns that I grew up with.
That was probably from my mayor's campaign, and your mother was on the city council.
That's right.
For the entire 8 years that I was mayor.
That's right.
And she was certainly one of the people that I listened to. And just like she tried to run your life, she tried to run my life. And did a pretty good job of it.
Well, both of you all have been dedicated public service. There's no question about it. And, Andy, you've had such an amazing career, starting as a pastor, as a minister, trained minister, being the executive director of SCLC early in your career. Everyone knows your history, your
one thing they don't know that's appropriate on this occasion is that my first little church was down in Thomasville and Beachton, Georgia. And they asked, they were looking for someone to lead, as they said in those days, the colored section of the March of Dimes. Mm. And I had grown up in New Orleans around various projects, and I volunteered, and I went up to Warm Springs, Georgia. And in those days, the March of Dimes was largely polio, and I think was founded by Franklin Roosevelt.
Yes, absolutely.
And it's an indication to me of how far we have come, because all I remember, I don't remember the Warm Springs and the ponds that President Roosevelt used to bathe in. Only thing I can never get out of my mind is a huge auditorium that was filled with iron lungs. Mm. In those days, polio required an iron lung treatment, which was like a casket with your head left, the only thing left out.
Yeah.
And the horrors of polio was something that I could not say no to. Even though, well, in those days, you fought about segregation in some ways, but there were some things that, I mean, it was more important for people to be sensitive to problems related to healthcare. I mean, after all, uh, those were life and death issues. Um, I hate to say this, but it's true. Uh, Segregation was a lifestyle issue.
Yeah.
It was horrible, and there were a lot of bad things about it, but it didn't kill you. Usually,
Yes.
it could on some occasions. You had too great a clash with it, but growing up in the South all my life, New Orleans and Atlanta, and then Thomasville and Beachton. I Well, I felt that the health of people and the people that I was serving uh, was more important uh, than arguing about color and discrimination. That
Mhm.
the March of Dimes, to its credit, uh, always reached out to Black and white citizens across. And
You know,
I don't know when.
I've talked about that a lot, and I'm so glad to hear you say that because it's something that I learned a lot about the March Times when after becoming president and CEO is that there was a long history of reaching out to the Black community during the vaccine and the rollout of the vaccine. I'm glad to hear your recollection of that as well. Do you talk a little bit about that experience of polio and now with coronavirus? You just thankfully very publicly went to get your vaccine. You did it with your
Well,
very good friend Hank Aaron, who has since passed, and we're all so incredibly saddened by that.
and it
Oh,
was also with um, the former Secretary of Health and Human Services.
David
Uh,
Satcher. David Satcher.
no, now you get my memory. Uh,
Your senior
Lou,
moment. That's
Lou,
okay. We all have those.
Lou
Lou
Sullivan, who was
Sullivan. Okay.
the founder of the Morehouse Medical School
Uh-huh.
and was the Secretary of Health and Human Services under President George Bush Elder.
Yes.
And I thought it would be important for the three of us to go together um, because people were still looking back and thinking about healthcare delivery, uh, and they were still talking about something that happened at Tuskegee in 1930 and 31. And I said I wasn't born until 32, and I believe I've been vaccinated for something just about every one of my 88 years. And I've had I had a whole set of the vaccinations before I could go to school. And then in my travels, you can't go from country to country without typhoid and cholera. And I, I, my work has taken me all over the world. And in most countries, if you've been to one country and go to the next one, um, if they had cholera in that country, you had to have a cholera shot before you could get into the next country. And so uh, then I have a flu shot every year, and I have my wife made me get shingles because one of her friends she talked about how painful shingles was. And I said, well, I don't believe I ever had chicken pox. My brother had chicken pox, but I don't think I had chicken pox. She said, yeah, but you might have, and you don't remember it. You better get your shot. And so, fortunately for me, it's been very, immunizations have been a part of all of our lives. And now when, and then they said, but it happened too quick. I said, no, it didn't happen quick. I said, I read about this young Black woman who had been doing research on tropical viruses for 6.5 years at University of North Carolina. And she was put in charge of the project, and she was just 34 years old.
Yes,
But
Kazmikir Corbin, right? At NIH, sure. Yeah, absolutely.
she had been studying it. And then we were, I was spending a lot of time in Africa after I left the mayor's office and around the Olympics. And so I was running into things like Ebola and HIV was first discovered, and the first public closure was I think Uganda or somewhere in East Africa, and so we wished we had a vaccine for some of these things, and I was up late one night in Zimbabwe, and I was going on a private plane to South Africa, and I had on a short sleeve shirt after midnight, and the mosquitoes ate me up. By the time I got to South Africa, I was beginning to I had a fever, and they immediately diagnosed it as the fact that I probably was getting malaria, and they gave me 3 tablets, and 3 tablets taken right at the right time in the beginning, and by 12 o'clock, 48 hours later, I was back to work and never had to. I had to quarantine, but I never had to go to the hospital or miss a meal.
Yeah.
And
So the great thing is you were able to, I mean, the message you sent in getting the vaccine, you with Dr. Lou Sullivan and Hank Aaron, was that we have to continue to have confidence in medicine, in science, and that the vaccine can be trusted, it's safe, and that message was really important. I want to ask you a question though about your as you've been working, especially when in your work through the civil rights movement and even today, you've been you've been seeing the effects of racism on the lives of Black people, especially in the South, but all over. You've even seen it outside the US. And I'm just wondering, how do you reflect on the effect that racism has on our health overall, the delivery of healthcare? Have we made advances, do you think? What more do we need to do to address the issue of racism as it affects our overall health?
well, it's the truth of it is it's probably more poverty than race. Not that race is not a factor in terms of delivery systems, but all poor people are suffering from medical neglect. Uh, in the Appalachian Mountains, the white poor, I think right now have the shortest lifespan of any people in America. And one of the things that helped Black people, in fact, we used to kid Hank Aaron about it, that my grandson says he's going to be the next Hank Aaron. And I said, no, you won't. You don't stand a chance. And he said, yes, I do. I'm going to practice. I'm going to practice. I said, yeah, but you're too rich. I said, Hank Aaron got his muscles because he had to get up every morning and chop wood. You're 10 years old and you never had to swing an axe. I said Hank had been swinging that axe since he was 5 or 6, and I that the lifestyle of the rural poor, they they had their own chickens, so they got fresh eggs from the chickens, and they grew their own corn, and they planted their vegetable gardens. And even me growing up in New Orleans in the Second World War, we had a victory garden. So we grew things that were healthy. And so it's urban poverty is more difficult to deal with than rural poverty. And even the even the spread of AIDS in Africa, I think, came about in part because there was a famine in Ethiopia, Sudan, and Uganda, and there was no food except the processed food that was coming from CARE and UNICEF, and people quit eating their native diets. And one of the reasons that Uganda came back from AIDS quicker was one of the doctors that had been there as a young man when they had no AIDS, no tuberculosis, no cancer, realized that part of that was that their diet was designed to help build resistance to that. I run in, they do something like very much like Korea, so and the Asians. Kimchi is fermented cabbage, and in Uganda, in East Africa, they bury the cabbage in the ground and let it ferment for a year. And when I saw that the Koreans and Japanese do some of that too, and in Asia, these are they're sort of life experience cures and prevention. It was well, in New Orleans we eat gumbo, and best gumbo is okra gumbo. One of my African friends came to my house and saw okra growing in the backyard. He said, "Oh, you like okra?" I said, "Yeah." He said, "Okra is strong medicine. Okra keeps you strong." See?
That's the secret to a long life. Good foods and
Well,
vegetables.
and the same thing with garlic.
Yes.
And with India, the same thing is true with turmeric. I mean, turmeric is a natural blood thinner. So they have fewer strokes and almost no Alzheimer's in India. And it's because of the traditional diets. And because I got involved with the Olympics, I was involved with the civil rights movement, I was at the United Nations. So I've been to about 140 countries.
So this idea of how we live and what we eat and
Well,
access to good food
but I noticed how people eat, and I noticed that where they live the longest, and I noticed how strong they are when they adhere to their native diets. But there, the problem is clean water. If you could just get clean water in most places in Africa, you would get rid of another dozen diseases. And so we have made significant technical advances in Western civilization, but we have water, but few of us drink, 10 ounces a day, 12 ounces of water a day. We tend to sip water, and we might drink Coca-Cola. But there's nothing that cleanses your body like 16 ounces of water a day. With water, if you drink a quart of water and walk a mile, probably add 10 years to your life.
Well, I know you've got a birthday coming up, And I won't say your age, but in advance, happy
No,
birthday.
let me tell you, I am very proud of my age. Um, that I, I said I was born in 1932, and that means right now, as of this moment, I'm 88, but I'll be 89 on the 12th of March.
Yeah.
And
Congratulations.
uh, the thing is that I, uh, I think I've always, well, my father was a dentist, and most of his friends, well, it's like your father was a physician,
Hmm.
and we got good medical care because we, even when we didn't go to the doctor, I'd run into your daddy at a party, and I'd say, I've been feeling such and such thing, and
And he always gave you good advice, I hope.
he'd always give me good advice. See, and so um, my health is not accidental. I've been blessed with good genes, good diet, and plenty of exercise.
Well, I want to touch on that too because you obviously not only you're a dad, but you've got your father of four, you're a grandfather of nine, great grandfather. Congratulations of one.
Yeah.
And you've been working on strengthening your own family in Black communities and all communities really over many decades. And I would love to hear how you think about the importance of good health, especially in Black communities. And what do we need to do to? I mean, one of the points you're just making around the importance of good nutrition is so important because that's one of the things we talk a lot about with respect to maternal infant health. That obviously access to safeties in housing, good nutrition, those things matter. In fact, most of what contributes to our good health are things that happen outside the doctor's office. What are you still seeing as some of the gaps in terms of what we need to do in the Black community to access better health? And are there obstacles we still need to address in order for us to get there?
Well, we have certain cultural bad habits. They're not. It was one thing when you were working in the field, um, and you were eating pigtails and chitlins and pig ear sandwiches, and you were going out in the field and you were sweating it out. But if you eat that kind of country diet, uh, and I'm guilty of it, and I'm amazed that I've survived. And the but I would always grab for the salt shaker, and actually my cardiologist always found me when they did my blood work. I didn't have enough sodium in my blood, and one of the things was, as a kid, and until I messed up my knees in my 60s, just before I turned 70, um, I ran everywhere. I ran up steps and down steps. And P.T. Vivian, who just died just last month at 96. But one of the things about CT was that every day on his way home from work, he would stop at the Morris Brown Stadium, and he'd run up that stadium, those stadium steps, uh, about 100 steps, and he'd run
Wow.
up those hills, up those steps, 5 times. He'd run up to the top, and then turn around and come back and run it again. And I I um, I ran everywhere as a kid. See, and I was on Howard's track team and swimming team. But I was always younger than everybody. So I was very conscious of trying to take, my daddy got free vitamin samples. I'd always confiscate vitamin samples thinking if I take my vitamins, it would make me bigger. It never did. But it built up a strong immune system. And I think that, well, I was, I guess, on the cover of one of the things I'm most proud of. I was on the cover of the AARP journal when I was about 67 or 68, because I took part in a bicycle ride across Georgia, where we rode our bicycles from South Carolina border all the way down to Savannah. And it took 5 days to do it, but we were riding, 75, 100 miles a day. And I was physically fit, and I worked at it. We had a fundraiser at the YMCA swimming pool, and I bet all my friends that I could, for my 75th birthday, that I could swim 75 lengths of the pool in an hour. And they said, "No, you
did you
can't
do
do
it?
that." I said, "Huh?" And
Did you do it?
and we set it up so that somebody was going to have to give the Y $25,000, and I didn't have the money, but I figured I could do it. And they all pledged money to the Y, and I swam the 75 lengths of the pool. Now, so until I turned 85, I was in very good health. But your knees do wear out. There's no question
Yeah.
about that.
Yeah,
Um,
I know they do. But you still look amazing, which I have to just say it's really amazing. And I think one of the things that one of the things I'm taking away from this conversation just is that we do have a lot of ability to manage our own health. But also, Andy, there's so many people in this country who lack access to good health care,
Andrew Boyoung
um,
or two others.
who
that's my
don't.
son.
Oh, that's your son.
I'm on a Zoom
Hi.
call. I'll get back to you.
There's so many people who lack access to healthcare. In rural counties in this country, we've seen. We did a study at the March Times looking at the number of women who live in what we call maternity care deserts. About half of the counties in this country lack access to any obstetrical care at all, or very limited care. A lot of rural hospitals have closed. And even if you're living in a county that does have where you have access to a hospital, or hospitals are there, or doctors are there, you may not have health coverage. And in states like from Texas across the South that haven't expanded Medicaid, so there are these barriers to even receiving the kind of care that we need when we do need it. When we've done all that we can do on our end, we certainly have to see a doctor. What have you, as you've seen this issue over, from the civil rights movement up until now, do you think that there's more that we should do in this country from a policy perspective to continue to push for more access to care for everyone, especially for people of color?
Well, there is more that we must do, and I think that this pandemic is going to revolutionize medicine and the way we think about it, and it's doing that already, because we have switched from cure to prevention. Uh, Doctors used to wait till you got sick. You wait till you got sick before you go to the doctor. The important thing is to find a way, and in any neighborhood, you can go to your fire station and they will check your blood pressure. And I think if you walk to the fire station and get your blood pressure checked once a month, see, just the walking, and I try to keep it simple, and I don't want to. Well, I don't like hospitals. know, I worked in a hospital, and they're places of last resort. But if you can drink water, exercise, and check your blood pressure uh, once a quarter, every 3 months, you know, and I think I started at 40 because Whitney Young, who was a very good friend of mine and who was head of the Urban League, um, drowned off the coast of Africa. And really, he was a good swimmer, but he got caught in a riptide, and it was pulling him out. He was swimming against it, and it gave him a heart attack. He didn't drown, but he lost his life. And he was older than me, but I just turned 40, and I decided then that every year on my birthday, I was going to the doctor to get a checkup.
Mm.
And I did that. Uh, and and I think an ounce of prevention is worth a pound of cure. But if you take care, if you watch your diet and watch your weight, watch your salt content, and take some vitamins and eat your vegetables, I'm thrilled with Atlanta. When you have to come around, there's a place called a gathering spot where all the young people hang out nowadays,
Yes, I've heard
and
about it.
you go there, and they give you. I mean, the number one diet item on the thing is some kind of broccoli. And the two things I hated growing up were broccoli and cauliflower. But they fixed broccoli and cauliflower in such a way that it's one of the most popular things on the menu. And then these two young ladies from Spelman that started these vegan burgers. They call themselves the Slutty Vegan
Yes,
Restaurant.
Slutty Vegan. Yes, very
and
popular, right?
there's a long, long line of people to eat vegetarian burgers. Uh, and there's another raw foods restaurant on Cascade. And I was with a friend of mine who was a vegetarian, and I we went there for lunch, um, and I ate the stuff, and damn if it wasn't pretty good.
It's pretty good, huh?
Yeah,
So
and
eating
that,
good, eating well can be eating really good
and
foods too.
I love Indian food, and I
Yes,
love Korean food, and it it's possible to enjoy your life and make your health um, a blessing and an opportunity. It
yes,
shouldn't be a burden.
yes.
Uh, but water and exercise and a good
It's
night's
really good.
sleep.
Yeah, can
Yeah.
cure a lot of
And
issues.
I am really a preacher. And the one thing I saw my mother and daddy do every night, they would never get into bed without getting down on their knees beside the bed and praying for me and my brother. I said, Mother, why you pray all every night? You got to pray. She said, I'm not praying for me. I'm praying for you.
Yes, and those prayers have
And
sustained you, I'm sure.
I think that when you pray, you unloading your burdens.
Mhm.
In fact, we used to have a song, pass your burdens to the Lord, leave them there. And so, uh, especially in this, I think one of the most dangerous things in this pandemic is boredom. People don't know what to do. and the news is quite often challenging and bad every day because if it bleeds, it leads.
Right.
And so if you're sitting at home in quarantine, you can get depressed.
Mhm.
And we had a 19-year-old in our church commit suicide last week, and that's nothing but depression.
Yeah,
And so you've got to keep your mind, your body, and your spirit healthy.
that's
And
amazing.
when you're feeling down, um, you just find somebody to call up and talk to.
Yeah.
Um,
There have been a lot of people who've discovered new things and new hobbies through the pandemic too,
well,
and it's relieved their emotional stress. Absolutely.
particularly older
Absolutely.
people who
Yeah.
can't get out. Um, yeah, you remember Mrs. Cooper uh, in Atlanta, and she lived to 107. And I would see Mrs. Cooper and call her up every now and then, and just talking to her um, would always cheer me up. And there was Mrs. Bako who lived to 104,
Yes.
and Mrs. McEwen, the wife of my pastor, she just passed, and she was 105. And these wise women uh, didn't get around, but they were always fun to be around, and they always had something encouraging to share with.
Yeah.
So visiting old folks helps you. And
That's
now
right.
that I'm one of those old folks, um, it really is just it's a help to just see you as young and beautiful as you always have been.
Oh, well, thank
And
you. I
and
do
it,
want to
it
make I want to make sure people know too that we can I want to remind people, and I should have said this earlier, we can certainly take questions on Facebook. And if you've got a question for Ambassador Young, I know he'll want to take it. And and as we're looking for those questions, I want to ask you something else because you attended Howard University, as you mentioned earlier, and we now have a vice president who also attended Howard University. And in your lifetime, as with not only is she a graduate of Howard University, she's a woman, and it's been a real milestone for especially for many women to actually finally see a woman as either president or vice president. Maybe one day we'll have a woman as president. We're happy to see one as vice president today, but get, can you reflect on that a little bit over the course of your life, from the civil rights movement till now, how meaningful it is to finally see a woman as vice president? And I'm sure how
well,
special it is to see one from Howard.
let me give you another piece of news that I think is maybe as important. The only country whose economy has been booming for the last 10 years, and their education is going up, their healthcare is getting better, everything about the country is working, is Rwanda. And I think almost 60% of the elected officials in Rwanda are women,
Yeah.
somewhere between 55 and 60%. But Germany's, the economy is going well in Germany. There's a woman prime minister. India came out of a lot of its Spanishness and racism under um Indira Gandhi. Um Strong women make good leaders. Um we've had, well, Shirley Franklin and now Keisha Lance Bottoms as mayors of Atlanta, and it's but women have always run our school system, almost always, and I think that there's something. There's a, it's not a matter of rising up and competing. It's a matter of what you need at the moment. And I think everybody got so tough and so mean spirited that the country right now needed the tenderness. And the truth of it is, Joe Biden, because of the sufferings and deaths in his life, um, is a very, very gentle man. And that's what the country needed. The country needed compassion. It needed understanding. It needed sensitivity. And, and he's getting things done. Now, I think what we're going to find out is that, and I said this about Kamala when she came to Atlanta, uh, and we had a fundraiser for her. I said, look, she had to deal with all of these hoodlum men at Howard University, and I said, you get all kinds of people coming through. I mean, I love Black people, um, and white people too. Asians tend to be very gentle, but at Howard, you would run into all kinds of people. And she was a very pretty girl.
Mhm.
And I said, I know she had to deal with a lot of aggressive hoodlums all of her life.
So
'Cause if she,
she can certainly manage as vice
so
president.
if she can get through Howard University, as a teenager, she can handle almost anything.
That's exactly right. Well, another part of your history is in your life, and I know it's a very important part. In fact, I'll tell you the little Bertie. Oh, that's your son again, I think.
That's my brother this time.
Oh,
I'm
that's
on a
your
Zoom
brother.
call, Walt. I'll call you back.
One of the things that I know is really important to you in your life has been being a member of Alpha Phi Alpha. The Alphas have been a huge part of our work at the March of Dimes. Alphas have been in partnership with March of Dimes for 40 years. We've done amazing things together. They have a whole project on talking about fatherhood and Project Alpha, and really enforcing and reinforcing for members of Alpha the importance of fatherhood. As I mentioned, you're a father, you're a great grandfather, you're a grandfather. Talk a little bit about the importance of Black men in
Well,
supporting
and
families. Love to hear more about
actually,
that.
I went to college too young, and I was lost. I mean, and wild and crazy. And David Dinkins had who was the mayor of New York, just come back from the Marines, and so he was about almost 8 years older than me, uh, and kind of took me under his wing, uh, and uh, and helped me adjust. And I was 16 at Howard,
Mm,
and it well, that happened to all of us. That whole generation. Martin Luther King, Maynard Jackson went to Morehouse at 14. Martin was 15. I went to Dillard at 15. And it was because it was right on the edge of the Second World War. And they took a lot of younger students in and let them skip a year. I wasn't like that. I went to kindergarten at a church nursery, and they taught me how to read and write. And when I got 6 years old, instead of putting me in first grade, they put me in third grade. So I had always been
wow.
struggling. And if you're younger and smaller than everybody, you got to make more noise and raise more hell. And so calming down and settling down to the place where you can fit in was something that the Alpha fraternity did for me. And actually, this is my 70th anniversary
70
of
years in Alpha Phi Alpha.
in
That's
Alpha Phi
amazing.
Alpha. And I might be the oldest one left. uh, but
Well, and I know they just started a social justice. The Alpha just started Andrew Young Social Justice Institute in your name,
well,
which
we started meeting with boys in Atlanta, that Project Alpha, and I was the mayor when we started it. And what we did was we got all these 12-year-old boys, um, and we told them what it is. What does it mean to be a man? And and whether you realize it or not, a 12 and 13-year-old boy can become a father.
yes.
See, physically, and but in terms of health, in terms of your studies and your future and your beliefs, and uh, we spent a morning uh, just talking about what it is. What does it mean to be a man? And like, yes, you can have a baby at 13, but you
Mhm.
got to take care of that baby for 20 years, and you don't know how to take care of yourself yet. So, teen pregnancy was one of the things that we tried to have an impact on. Uh, Unfortunately, um, there were too many guns going around the Black community, and so
Mhm.
you had kids who had access to guns, and that led to gangs. And uh, we were trying to cut that off before it happened. And I think the fraternity did a very good job. But part of the health initiative was uh, through the March of Dimes,
Mhm. Mhm.
and you really can't be human alone. There's one thing that I grew up in New Orleans, and the one lesson I think that I learned first in life may be the most important one I learned. The Nazi party was on the corner of my house, and they were Highland Hitler. And I was 4 years old, and my daddy we were walking by there, and I said, "What are they Highland Hitler for, Daddy?" And he said, "These are white supremacists. And you know that God made of one blood all the nations of the earth, but they don't want to admit that." And he said, "But white supremacy is a sickness." And he said, "You don't get angry with sick people. You try
Mhm.
to help them." And he said, "But you're too young to help them now. But you know, don't ever don't ever let them get you upset, or you don't have to be afraid of sick people. You just have to kind of uh, use your mind." And he was short. He was 5'4", and he said, you're never going to be very big. You might make 5, 6, 7, but you're not going to be big enough to beat up everybody. He said, but if you use your mind is going to be more powerful than your fist or your feet, running or fighting. And he said, you can think your way through anything if you don't get upset. And his mantra for me all my life was, don't get mad, get smart.
Yeah.
And when you
Well, that
lose your temper in a fight, if you get angry, you're hurting yourself, and you're
right.
weakening your own mental capacity. And I think teaching people, and that was my foundation in nonviolence,
Mm.
that helped so much with Martin Luther King,
Mhm.
because he'd
And
heard some of the same lessons.
And these are, I mean, it's amazing, isn't it amazing to you that it seems like we still need to be telling ourselves these lessons today, right? I mean, even what we've seen with January
Well,
6th
well,
and
well, that's the thing that, and that's the reason I don't like to talk about race as race, because these are all human problems. And if you're growing up with a healthy spiritual and mental attitude, you don't get angry. You don't have a temper. You know, you use your mind, and anger kills you.
mm,
I, when people talked about the militant young people in the civil rights movement, I said, you know, the tragedy of the militants was most of them died young, and white people didn't kill them, but they got angry and they got upset and they were afraid, and they had ulcers, you know, in their 40s, and they had heart trouble, and they were victims of their own anxiety over race. So the message, you know, for survival and good and mental health is don't get mad, get smart. See,
wow,
and
that,
um,
that's great
and
advice for a lot of us.
I think that that's important. Well, I don't know in all my years that there's been more crisis going on simultaneously than there was. I mean, the whole idea of somebody trying to disrupt the Capitol and cancel out an election. I mean, this is unthinkable for me until the last few months, and yet it happened. And so, um, good health, good health is part of being civilized, and that means good mental health. See, and it means the capacity to understand and even to love your enemies. And My job with Martin Luther King was, and that's the difference, one of the differences between the civil rights movement in the 60s and Black Lives Matter. Black Lives Matter happened so fast, they didn't get a chance to organize. But in Atlanta, the student movement, before they started demonstrating, they got together for almost a month and wrote out their manifesto, what it was they were demonstrating about, what it was they wanted. And it took them, you know, a couple of months to get it organized and get it together. With George Floyd's death, it happened in 8 minutes and 46 seconds. And we saw him die. Sally or Sally Rosser. And we said, excuse me, I'm on a call, a Zoom call. I'll call you back. Um, we really needed some time, um, but that didn't give us any time. And we were on, the country was on lockdown. So everybody was watching. It's like people knew about the bridge in Selma because that happened to be a snowstorm up north that Sunday afternoon, and everybody saw it. And I don't know whether you remember, there was a picture on the cover of Life magazine of a little girl walking down a road crying with no clothes on, with the napalm bomb had burned her clothes off, and it was a little girl walking down a empty road crying on the cover of Life magazine. Well, I think that picture stopped the war in Vietnam, because
Mhm.
people saw it and said, no, I don't want to be a part of a country that's doing that. See? And I think that's what happened with that was George Floyd's blessing to America. It cost him his life, but he awakened a generation.
Yes.
And he did something Martin Luther King couldn't do. He opened up the mind of the business community. And
Mhm.
so all of a sudden, the business community began to realize we can't do business in a world like this. And it hurts us more than it hurts anybody else. And that when Citigroup did a study that said that discrimination cost the country between 2000 and 2020, it cost the country $16 trillion just to discriminate against minorities and women. That if you end discrimination, you'd be $16 trillion richer. And the whole country's economy is only 19 trillion a year.
Yeah.
So that's a whole lot of money. And I think that because of the pandemic and because George Floyd's death happened in the middle of it, uh, it forced us to think ways that we had never been able to think before. So
Well,
I think we're coming out on the good side of this. We're going to be
and this,
better off. And after all, um, it was one or two, maybe 10, 15 deaths. But the violence, well, on the other hand, you had the health crisis of the coronavirus killing more people than died in World War II. So we have all of this going on simultaneously in the last 6 months. And believe it or not, I think we're going to come out of this better than we were before in almost
well,
every way.
I hope you're right, and I know that you're right because you've been right for so long, and on so many things. And I know we're just at the end of this. I just would like to ask if you would just close us with what thoughts would you have about what we can do and reflecting on Black History Month this month. And we,
Well,
as you mentioned, we have so many challenges. What would you put out for us in terms of really dealing with some of the issues around equity and how do we improve lives for all people of all backgrounds in this country? What do we need to do as a country to heal and come together?
well, let me say that this is Black History Month, and I'm supposed to be preaching at our church this Sunday, a First Congregational Church, and I decided I didn't want to preach about the Black history, and that really wanted to stop and think about the Black future, because and and I based this on the gathering spot in Atlanta. See, and I based this on all of the, well, you went to Spelman, didn't you?
Now I went to Georgetown, almost went to Spelman.
Okay. But well, Roz Brewer, Spelman
Yes,
graduate, is now head of Walgreens.
that's right.
See, to me, that's as significant, if not more so, than being vice president. Uh, and that good things are happening.
Yes.
Somebody gave me a technology magazine, and my neighbor who grew up, you know, uh, Mike Ross, who grew up right
Yeah.
next to me, um, there was an article about all of the startup companies he has helped as an angel investor. And it must be almost 20 of them.
Yes.
And I didn't know that. See,
And he's right. And he
but
lived, and he was right. You're not your next door neighbor,
he
huh?
was my next door neighbor. And I see him and we talk and we I mean, I used to play basketball with him when he was 12 years old. And but he's an entrepreneur, and he's an angel investor, and they must have listed something like 20 companies that he had a hand in starting.
Yeah.
Well, most of these are young Black businesses, and he's not rich, but he made money at the airport as a project manager, but he still walks around in his old raggedy suits, and he doesn't have a big fancy car. See, but instead of pimping his money, he invested it, and he
Yeah.
invested it in other young Black people, and I didn't know that was happening until a couple of days ago. See, and then I started putting together all the things I know, and all the things that you know, even my own children are doing things that I don't quite understand. And my daddy used to try to discourage me when I had crazy ideas like leaving a job in New York and coming back to Atlanta to be with Martin Luther King. He would have much rather had me safe in New York in a secure business shop, see, than coming
Yeah.
back to the South. But he was wrong.
Yeah.
And so I tried not to be wrong. And I'm really proud of these young people in everything that they're doing. And that starts with you.
So let's have some hope in our future, and there's a lot to look forward to. And I agree with you. I think even through the worst these times, there will be good things to come from all of the pain and suffering we're going through now. Well, Andy, thank you so much, and thank you for that compliment. I appreciate that. And you've meant so much to me in my life. You've always been someone that I've admired, and so many people in this country and around the world are so grateful for all that you've done in your life. And I just
Well,
want to
I've
say
been
thank you for being a
blessed, and
part of
I've
this
been
today.
blessed by just being in the right place at the right time and doing the right thing most of the time.
Most of the time. Well, good. Well, thank you so much. And it's so great to see you. So great to be with you. I'm just so honored to have this conversation. And hopefully we can do it again at some point in the future. And in advance, happy birthday again.
Thanks a lot.
Okay. Thank you. Thanks everybody for joining.